In the ever-changing world of healthcare, are you looking to get advice and learn to prepare for healthcare challenges that you may face? Come join a conversation about all things healthcare and wellness with your hosts, Gavin Wiswell and Dr. Monsi Shaw.
Welcome to the Healthcare Corner, everyone. And today it's great to have Dr. Monsi Shaw in studio for her first time on the video portion of the Healthcare Corner. So, Monsi, how you liking it?
I'm loving this. This is amazing and a whole different kind of experience. So I am ready to get this episode started.
100%. And we're grateful for Todd and Kevin and everybody putting this all together for us here down at KCBQ here in San Diego. So today's topic is something that we're going to rely heavily on your knowledge for, Dr. Shaw. We're talking about regenerative medicine and advances in the field. And we've talked a lot about the microbiome, and we've talked about all the omics as well here on the show. And so for those of you that are longtime listeners of the Healthcare Corner, you know that hcshow.net is where you can go listen to all of those old episodes. But for those that are just joining us, you're going to want to maybe listen to this episode, take a pen and paper, write down some great things that Dr. Shaw is going to mention today. And we're going to open it up to really kind of what are these new advances in the last maybe 6 months in this field, because it's changing so rapidly, and maybe make a couple episodes out of this topic. So,
Yeah,
Monsi, we're ready to go.
absolutely. We are going to need more episodes on this because today we're just introducing the topic and talking about the advances in the field and how we're kind of behind when it comes to America and how other countries are doing this on a next level basis.
So, regenerative medicine is been a hot topic for quite some time now, and I know that, like you just mentioned, that internationally there's more acceptance of the practice. And so today, I think that what we want to really cover is, really what is it, and maybe what diagnoses regenerative medicine is good for. Is it a panacea? Does it really cover everything, or doesn't it? And then when it talks about quality and control, we want to make sure that all of our listeners are better consumers of healthcare education out there. So knowing the pitfalls, the opportunity, and really to just educate themselves on this topic. So where do
Yeah.
we start here, Doc?
Let's start with what is regenerative medicine and then what all is considered a part of it. And then we'll dive deeper into what's what and what it means, right? So basically, I would start with regenerative medicine being something that is enhancing your body's potential to heal because our body has its innate ability through many different mechanisms. And regenerative medicine is based on that whole concept that, we have our bones and our skin and our muscles and tissues, they all kind of almost degenerate, right? And then when time to time, don't we see that we have injuries or pitfalls and then we start healing from it? But after a certain age, we do not get the complete healing that we need because the innate ability has gone down.
And what is that age typically?
About 30 to 35 is where it starts going to a phase of decline. And some people might have it a little more than others, and some people might have it less, but it all depends on your diet and lifestyle at the end.
Sure.
Because some people start beating up their lifestyle early on when they're young. And some people are really good on keeping up, and then they keep it really to the point where it's easier for their body to heal. You've seen it, right? Like
Right.
some people just heal faster than others. So that's our innate ability, and that is the basis of regenerative medicine.
Excellent. So when you're looking at, say, chronic disease, say heart disease, stroke, diabetes, osteoarthritis, um, these are issues that sometimes can be preventable 10, 15, 20 years prior, or you see somebody that's trending in that way to have these chronic conditions. At what point do you introduce regenerative medicine to some of these people living with chronic illness? Is it the earlier the better? Is there a preventative way of using regenerative medicine, or
Yeah, I mean, it could be used preventative. prophylactic or treatment too, because I mean, today's world, even kids are getting cancer. That's not normal.
Right.
So
Right.
we're in this whole pandemic of toxin overload.
Right.
Let's put it that way. We have packaged foods and processed meats and toxin overload. So our era is different than what it used to be 50, 70 years ago when our parents and grandparents grew up. They did not eat out of boxes.
Right.
They had fresh meals.
Yeah, it was off the farm, right? You've got the chickens out there, you've got the fields, all that. My family came from Kansas, and so they had the farm, and that was healthy, good food back then. Yeah.
Yeah, my grandpa was a farmer and his parents were like big time landlords that they had like lots of farming happening. So we don't eat like that. I'm always going to like I know I'm a healthy eater
Right.
and I make better choices, but I'm still because of shortage of time, I'm still going to healthy restaurants and it's still produced in mass and I don't know if it's always organic or it's hard,
Right.
right?
Right.
So
So I think if we want to maybe structure the next hour for our listeners, I think it would be good for us to maybe talk a little bit about the foundational work of regenerative medicine. So you've got that, and you've got rehabilitation, and then we've got concepts like peptides and stem cells and exosomes. So if we want to maybe start with somebody that has no knowledge or a basic knowledge of regenerative medicine, Monsi, where would we start developing that concept of understanding?
as I said, that basis of body's innate ability to heal.
Mhm.
Now, think about this. When we were conceived, we were all conceived through our own stem cells. That is happening in the mother's womb, that our own stem cells are created. And that is the God's technology of creating a human being. Now, that stem cell is a pool of cells that's available throughout our lifetime. And it just depends on what gene through your lifestyle got activated and what disease you got, and then how these stem cells are actually affected and how it's healing you or not healing you or just staying in a dormant phase. So that's where a basic understanding of regenerative medicine can be started.
Gotcha. So we've got somebody that's younger, say in their 20s, and then now they're producing these uh, um, stem cells, etc. Uh, then they grow older, and now they're starting to decay, right? Like you're talking about. So how does maybe a younger, more pure uh, these I guess new tissues or new cells come in to support and actually not exacerbate the already decrepit old cells. So how do you take old cells maybe here and have new cells and then have the new cells really destroy and get rid of the old cells? Am I thinking about that the right way, or what does it
Yeah,
really
you're
do?
thinking of it on the right lines. So basically, regenerative medicine goes beyond disease management to search for the discovery that, different therapies that support the body in repairing, regenerating, and of course, also restoring itself to a state of well being, right? And that's a definition coming from straight from Mayo Clinic.
Mhm.
Now, how do we do that is many different ways, and that's why we need to understand what are different types of adult stem cells. So there is the hematopoietic stem cells, mesenchymal stem cells, neural stem cells, epithelial stem cells, and skin stem cells. These are the different types of stem cells that are through different technologies extracted and then reintroduced in the body to basically accentuate the healing ability.
So is one of these more common than the other, or does it really depend on the disease that you're going after? Obviously, if you have conditions, probably the skin stem cells would be better to use. And
Yeah, I
um,
mean, different stem cells are researched differently
mhm.
in different clinics and different universities. And we just have to look at in a way where what data and research is out there supporting the type of disease or prophylactic treatments that we're looking to do, if that makes sense.
Gotcha. So we have all these different types of stem cells. We're really trying to enhance tissue and organ function. And so uh, how does the patient know, I guess, where to start? So we've got all this wonderful research going on, and most of stem cell research is not being utilized here in the States. I know we have international listeners here, so it might be different in the countries that you're listening to the show. But um, I think back to some of our older episodes, Monty, about nutraceuticals versus regular vitamins, and I know the FDA generally oversees stem cells and that sort of thing here in the U.S. But what can our listeners do, or what can a patient do to really educate themselves on the right type of cell therapy?
Honestly, there's a lot of mixed information out there. So you need to at least get like expert opinions of 2 to 3 practitioners, research the cell, what kind of third party validations they have from different research universities. Because even though US is limited in what we are doing usage wise, US is really good when it comes to research.
Mhm.
So they are partnering with different labs out there and actually giving out validations on how these quality cells are and how they can actually affect or not. So basically, we need to look into it at a level where it's more of a personal due diligence. And then when it comes to expert opinion, just like how if you want to get a surgery, wouldn't you want to go to 2, 3 experts in the industry?
At least, right? And depending upon the severity of that surgery as well. So I think if you're excited to learn more, what we're going to talk about on the other side of the break is really what Dr. Shaw does in understanding where, I guess the point of where a patient or a client maybe would come in, understand that you can't just apply stem cell treatment to a person right away. So Dr. Shaw is going to talk about really that holistic approach on what a patient should look for, so that as they're getting these opinions, it's going to give them a better opportunity to really understand the efficacy of stem cells and everything else that's going on there.
Absolutely. So we'll dive into that in the second segment.
Don't go anywhere. Stick with us here on the Healthcare Corner.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell and Dr. Mansi Shah.
Excellent. So, Monsi, I'd love to maybe in this segment really kind of unpack that like, so I'm somebody living with a chronic disease. I think that stem cells might be right for me. Um, what are all the different points we've got to consider? You just mentioned that, hey, there's a lot of research, different opinions, but if I have no understanding, if I'm an absolute beginner, how do I even go about knowing what the right opinion looks like? Maybe we can start with that.
Yeah, we can do that. And then, of course, I want to share my experience that
Yeah.
I am someone who becomes a patient first before even bringing in a patient into a new type of a treatment protocol. So that's what I did. Is I
Awesome.
myself went and got the whole experience,
What,
and we can share that in segment 3.
Wonderful. I don't know if we're able to switch the mic a little bit, but it's, I think, at an angle where it's kind of in and out a little bit. Todd, did you hear that a little bit? It was kind of, yeah,
Because it's going back. Maybe that's why.
yeah,
We want to do that one?
yeah. Maybe,
Yeah, that's better.
perfect. Okay, yeah, that's more comfortable.
'Cause that one.
Yeah, I think just the angle wasn't great for you. Oh, perfect. Awesome. Thanks, Todd.
And then does this work? That way I don't have to, because I always have notes on my phone.
Yeah.
But if this works, yeah, it works. So why not? Okay, cool. That works.
Oh,
It's easier. The next time when we set it up, we can just have our document on the computer. You have your laptop, but I
Yeah.
don't usually bring it. So
Oh, gotcha. Yeah. All righty. I think we're ready for round two. Yeah, I don't.
it won't work, right?
Yeah, because
Okay.
you would. Yeah. Sorry about
Makes
that.
sense. No, I just wanted to make sure. Okay.
Yeah. Okay, I think we're ready to go. Thank you.
Welcome back to Healthcare Corner, where you're a part of the conversation with your host, Gavin Wiswell and Dr. Monsi Shah.
Welcome back to the Healthcare Corner, everyone. And today, Dr. Monsi and I are talking about exosomes. We're talking about regenerative medicine, everything about advances in that field. And Monsi, what I love about your approach to wellness is that you really make sure that things work for you personally before you test it on anybody else, or really you have a great opinion of how something works before ever introducing that to any of your clients.
Yeah.
So
I'm my first patient all the time.
it's a great way to go about it, I think, right?
Yeah, I mean, that makes me a better doctor. And then, of course, I know if it works, what doesn't work, like, do no harm. So why don't I just try it on myself and become the human guinea pig for my patients?
You know, the only other person that I know that was that way was my dad. And so he was a research scientist, and he'd take those huge biopsy needles, right? And he'd go in and he'd get tissue out off his own body first. And I mean, I would faint just even looking at that needle, right? Because you got to go in there and cut the muscle and bring it out. And I was so proud of him for, being that dedicated to his science to do that. So I think in that same vein, our listeners are going to really appreciate your approach today. So yeah, let's go through that. Let's say that I might be a good candidate for regenerative medicine. You talked about last segment getting the need to maybe have 2 or 3 opinions. So how do I even begin to understand what's out there, who's to talk to, what even a good opinion looks like?
So find a local doctor like myself or someone else who's been researching and also has had it themselves. And then what is their research saying compared to what's out there in the market? Because there is some very funny clinics too out there. And someone I was talking to was telling me how they got shark stem cells. And I'm like, what are you talking about?
Wow. And goat stem cells too, right?
Yeah, shark and goat. I mean, that's not what we should be doing. That's not milk.
Right.
We're not getting milk from the market. These are cells, right?
Right.
So you want to make sure it's not some kind of mammal cells. And then of course you want to research what cells actually gives the highest results, along with how is the extraction process and what's the technology used and how this can really enhance your healing potential.
So the cells really enhance any part of the body it's going into, right? So if it goes into, well, I guess I had a doctor once that kind of explained to me that they're really, those cells are going in there to enhance that. So if there was a really bad interaction introduced, the stem cells would increase that bad interaction. Is that correct, or is that not correct? Meaning you have to be very careful how you use these cells, right? It's not.
They could be dangerous.
Gotcha.
If they're not the right kind.
Yeah.
That's why extraction procedure, along with what these different types offer, because you need a healthy stem cell to even go and do the work, because we are trying to regenerate the body. To do that, it has to have the highest purity and the highest healing potential for the body to regenerate, right?
Right.
And that's why it could be dangerous. And there is mixed data out there when it comes to the type of stem cells. And that's one thing that people don't understand, because it's not something you go to school for here, right?
Right.
So it's a new field, and it's changing very fast, and it's gonna be the future.
So I know that you don't really have to work hard to get clients, right? Like if they're at their the end of their wits, they don't know, why traditional medicine isn't working. And so you're kind of that last support of, hey, let's go in there, let's figure out what's going on. And so if someone is at that point where now traditional medicine hasn't worked. Now I come to you. You don't start with regenerative medicine, do you? Or how do you really start addressing that person that's really trying to figure out what's going on?
So let's do a sample workup, right?
Sure.
So I just had a couple patients who are a candidate
Mhm.
for regenerative medicine, but I still did a lot of workup where we did the full 30-day functional medicine protocol. So I got the files, I'm looking at them, and then deciding when it all started, how long it's been, what is it that hasn't been resolved. So one of the patient had mercury toxicity that wasn't addressed. And then they've been working at a chemical plant, and that's where it all started for them. It's been 8 years. So we did a whole detox regimen and functional medicine protocols to bring the body to a level where we can even think about regenerative medicine. And then in that 30-day protocol, what did I prescribe? It was gut health that we looked at. So they had labs. So I was able to look at that. I was able to look at micronutritional deficiencies. I was also able to analyze heavy metal toxicity, how bad the liver's clogged, and then, leaky gut confirmed. And then we started the workup. So we started with hydrocolonics, nutraceuticals. Again, nutraceuticals are different than supplements. So we did that. I did a little bit of peptide workup with them, and then we decided what type of, along with the board advisory board that we have in Mexico, we decided what type of treatment they would go under on the protocols with their regenerative medicine.
So you brought up peptides. Can you explain a little bit about what those are specifically and how that relates to the regenerative
Yeah, so
medicine?
these are basically therapeutic peptides, and peptides are the building blocks,
Mhm.
the protein molecules that our body has that we ourselves make through, the nutrition and the amino acids and different molecules combined. But when the body becomes diseased, it becomes difficult for body to have these peptides available in the quantity that it is needed to heal and regenerate. So that's why external peptides can come handy. For an example, BPC 157, which is one of the molecules that is used very, very generously now in the regenerative medicine peptide world. And we can talk more about that. That alone is amazingly working to help heal the wounds, the injuries and different things.
Gotcha. No, that's fascinating. So now you've done this workup and you've identified that potentially the person is improving their diet, they're improving their exercise, they're getting better sleep, but it's still not enough. When does that conversation turn to, okay, now your body's not able to produce what it needs to, let's look at this regenerative medicine track?
It all depends on the length of the time that they have been suffering for. This patient is been suffering for 8 years, so they've completely lost their life.
Right.
And it is at a point where we definitely have to look into it. And then the functional medicine protocols and detox is more of a prerequisite to bring the body to a level where the stem cells will actually do work that is at its best potential.
So I appreciate you starting the segment talking about you trying things before you try them with your clients. So would love to hear about your experience with regenerative medicine and kind of that journey.
Absolutely. Yeah, let's dive into that for segment 3. And I would love to share how I got into it and what was my experience with stem cells and how I ended up in the clinic in Mexico.
Certainly, yeah. So we'll tease that out for we'll do that in segment 3 for sure. So the other thing, Monsi, that I've heard is that there's different ways of really, I guess, ingesting or taking in these types of stem cells. So, as an example, I knew someone during COVID that actually had a nebulizer with exosomes.
Yeah.
And so they did treatment that way. So they inhaled them. There's also injections. What other forms are taken?
So some of the most commonly done procedures for regenerative medicine is IV, IM,
Mhm.
intra-articular, intrathecal is extensive and it actually needs a surgical procedure. So, you have to go under anesthesia for that. And honestly, it could be also sometimes local. Like we had a guy that I saw, he was getting a treatment done on his face. It was about getting stem cells on his face for regenerating his looks because he had been going through a lot of sunburn and alcohol, and it takes a toll on the body when you're doing a lot of things that are not supporting your lifestyle. So yeah, there's nebulizer treatment. We also had someone there when I was there. They did actually drops of stem cells in their eyes. Yeah, and that has been also something that has worked. So it all depends on the doctor's experience. The doctor that I had hired for my treatment has 18 years of experience with stem cells.
Which is so important because again, they're not all created equal, right? And so the FDA does their best job to, I guess, control the efficacy there. And I think in the last couple minutes that we have in this segment, maybe we can tease out the different types of diagnoses, right? So I know that it's not always for chronic illness, right? Like you mentioned for hair potentially. So does it work
Yeah.
with hair regrowth?
Yeah, hair I've seen skin rejuvenation,
Mhm.
anti-aging benefits.
Right.
I've seen, joints and just regular wear and tear. It doesn't always have to be a chronic illness like an autoimmune.
Gotcha. And so is there anything that it doesn't work for?
Yeah, I mean, there is non-responders out there, right? And also it all depends on the type of cells and amount of cells that were given. Sometimes it could be just a low dose that was administered and the body needed more. So I would say it would not work for someone who's gone past a, a damage control phase, where if it's end of life, like we're talking maybe hospice, who
It's
knows?
almost too little, too late, right?
Yeah.
So you're going to want to stick with us here on the Healthcare Corner as we continue to talk about regenerative medicine, how it works, and we're going to get to hear Dr. Shaw's story personally on the other side here. So don't go anywhere as we continue on the Healthcare Corner.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell and Dr. Mansi Shah.
Excellent. I thought the sound was really great that time. Wasn't it better, Todd? Yeah. So
Okay, good.
yeah. So I think let's get into your story and we'll talk about that. What else do we want to talk about in this, or do you think you'll have content for the whole 12 minutes?
Yeah, I think, I mean, how I got introduced to this clinic and
Yeah.
what was the story behind it, how I went there, what was my expectations versus what happened, and all that kind of stuff.
So I'll try to set it up as, hey, if I'm a patient, I'm going to be asking follow-up questions as you're telling your story.
Yeah.
Perfect. Okay. Excellent, Todd. I think we're ready.
Welcome back to Healthcare Corner, where you're a part of the conversation with your host, Gavin Wiswell and Dr. Mansi Shah.
Welcome back to the Healthcare Corner, everyone. And today's episode is brought to you by Vertere Health. As you can see on our video, for those that are watching the show, it's VIRTARE Health. And you can find them at verterehealth.com, and they are your transitional care support. So if you're a hospital or a provider group, even if you're a patient and you're looking to get proactive help with understanding your daily vitals and information in between your doctor visits, go to verterehealth.com and see if they can help you with anything that might ail you. So we're grateful for them to be our sponsor. And Monty, this is the part of the show I've really wanted to get to is really understanding your story, and I'm going to attempt to ask questions as a potential client. So if I'm someone that is appropriate for the journey that you've taken, I'm going to try to stop you during your story to see, are these the types of questions I should be asking, or what would be better questions? So if you could start with your journey, we'd love to go from there.
Absolutely. So I've struggled with gut health, and my first, honestly, I would say, episode of my struggle started in pharmacy school when I was 23. Slept on a recliner couch for 6 months with gut issues, to the point where almost twice I called 911. No help from the doctors with student insurance. So that was when I really got introduced to functional medicine, and I had to do a lot of lifestyle changes to bring about the greatest, I would say, um, like greatest change in my health,
Sure.
right?
Benefit, yeah.
Then everything got good and I knew how to manage it. 10 years later, in 2020, I had a massive episode again. 2020, 6 months bedridden, health issues, same thing, but more advanced now because 23 versus 34, right?
Right.
Or 35. So basically, I was struggling, and I had come to a point where I tried everything with functional medicine and I just couldn't get that last 10 to 15% back of my health. And I just couldn't do it anymore when it came to managing my lifestyle, because I'm doing everything I should be doing.
Yeah.
And I
Eating
started
right, sleeping, exercising,
everything.
doing everything. Yeah.
And then I'm like, there's nothing else I can do now. I mean, I'm sure I could still improvise a little bit, but it's hard when you're a full-time entrepreneur and a clinician too, right? Because
Sure.
you have to be ready and be there for your patients. So basically, this last 2 years, I started researching stem cells and started understanding what they mean, how they have the healing potential, what are the different kinds out there, what's available in the United States versus what's available in other countries. I talked to a few people who've actually done stem cell treatments here in the United States, and they couldn't really point out anywhere where I could get the best cells.
Mhm.
And then I started dabbling into international institutions where I could go and get stem cells. Then I learned more about this clinic in Guadalajara that I decided to go with because of the stringent procedure that they have when it comes to their labs and how they process stem cells and what type of stem cells are available, and how they've had 18 years of data and almost 10 to 12,000 cases that they have solved.
And so how do they share that data with you as a patient to give you that confidence that, hey, this is the right provider for me?
I mean, they showed me the whole presentation on the lab, and then of course I have about 2 3 other doctors who have used the clinic for personal use, and that's where I really learned about it, where one of the dogs had COVID, and then they had lost almost their lungs. It was literally black when it came to their scans, and then they went and got the stem cells because their quality of life was really poor.
Mhm.
They had respiratory problems, they had breathing issues, they had workout issues, and it's just not the same anymore. Just like how I struggle with my gut health, and it's not been the same. COVID hit them, and then it wasn't the same for them.
Sure.
So come about 3 months later, after the doctor got their treatments, these scans came out where the lungs look really pink again.
Wow.
From black. So I was like, wow, this is amazing. And then, one other close friend had psoriasis, other friend had gout. It's just all of these, like about 4 or 5 other testimonials from the same clinic that I got before I even decided to go.
So if I'm a patient out there and I find a great clinic and I've got an opinion like you did, how do I know the efficacy of the product? Do they share where they get that from? Or so, like you mentioned, shark or goat, stem cells. So how do I know that you're not part shark now, right? That sort of thing.
Right. Yeah, the clinic I went to, they're very, very strict on their protocols. They explain me how many cells I'm getting, what kind of exosomes I'm getting, what peptides I
And
got.
does that change per treatment? So, like, if I'm getting stem cells for hair replacement, is that a certain part per million, or
Yeah,
whereas others? So, what's your average stem cell dose, if I can ask?
average stem cell dose, I would say about 100 million cells,
Mhm.
and then exosome about 5 billion
Gotcha.
is would be a good place to start.
And what's that cost typically?
It depends. It's hard to tell because it's not a cookie cutter approach, but they are pretty pricey. Let's put it that way. And people are ready to spend to get their life back because this is one of the biggest investment that they will make in their health.
So that could be a big risk for this abuse, right? Where or you're getting stem cells, but they're not really the right stem cells. So I've seen anything from $500 a treatment to 1,500, maybe 2,000 a treatment. Is that still accurate?
Yeah, I mean, if they are the elite cells that I'm talking about,
Mhm.
they start at about 10, 15K.
So for some of us that are less science oriented, are we talking about how do you do the matching? Is it not like you don't have to worry about blood type? You have to worry about the age of the person that you're getting the stem cell from. So how do they make sure that these are the right stem cells for you? If you're spending that kind of money, obviously you want the best, most efficacious product.
Yeah, so honestly, when you're wanting to get the best efficacious product out there, you wanna definitely understand what type of stem cells
Yeah.
you're getting, what is the extraction procedure, and of course, what is their, uh, regulations and how they're governed by the local bodies. Because, like, let's say you go to Mexico or Panama or Costa Rica, different type of stem cells are available, but if it's a lab that is registered under the local governing body and they have the licensing and the procedure and the validation on the protocols, then you really know. And of course, you want to make sure like how long they've been in business, what kind of treatments they've done. Like there's different ways to do that, and that's what I did. So you definitely want to make sure that you're getting passage one if you're getting MSC cells.
Gotcha. So in your experience, you get passage one MSC cells. How long does the treatment take? The recovery, all of that. Would that be something you'd be able to share with our listeners?
Yeah, absolutely. So I started feeling about next day, like my energy levels were different. I actually started working out. I hadn't worked out in 2 years because I mean I do yoga, but I didn't have the energy to hit the gym and actually do workouts because my workout recovery from weight training wasn't the same anymore because
Wow.
of the gut issues. So I could only do yoga and walks. But now I can actually lift weights and stuff. So I started feeling the next day and then the day after. So we can see anywhere from couple hours to a couple weeks to a couple months.
And regardless of procedure, is that kind of standard where you can maybe
Mhm.
even see hair growth within a couple hours to a couple of days of
I
that
wouldn't say
cell? Or
hair growth would be that fast, but the patient that we talked about when the face treatment happened, that
Mhm.
that took 30 days. And I will show you the pictures. Maybe we can share it since we're doing video
Sure.
sometime.
Yeah.
Um, this guy looks from being looking like a 65, he looks 45
Wow.
in
Wow.
30 days.
Amazing. Amazing. So what other parts of your journey would you love to share with
Yeah,
our
I
audience?
would love to share about how Guadalajara was one of the most elite cities that I went to, and I did not expect what I saw. It's very nicely done, and I was at like the this area called San Andreas, and it was very elite. The type of people I saw is so different from what I see in TJ.
Sure.
Um, you know, most people spoke English or at least understood, and it was a very amazing experience. And the food was really good. It was so clean. It's just it just felt really good. And the experience at the clinic, the professionalism at the clinic, they're really well trained. These doctors are top notch for their country that actually can match to American standards. Isn't that amazing?
It really is, and I think with technology out there, right, it gives us an opportunity to have some of the best in the world stay where they are locally, and really provide care for the masses. We had Dr. Andres Smith, who works with the Red Cross in Mexico, talk about the medical tourism that goes on, and just the state of the art equipment and facilities that they have down there. So
Yeah,
I,
it was the same.
I think what I'm hearing from you, Monsi, is that, and we'll wrap this up in our next segment, but really, if you do your research, if you understand what your options are, and it sounds like if you've exhausted a lot of the traditional methods, then you're the type of consumer that this could be really right for you. And so that medical tourism, not only do you get some support with your condition, but you also get to see the world and make it a great experience too. So don't go anywhere as we wrap up our episode here on the Healthcare Corner on regenerative medicine.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell and Dr. Mansi Shah.
Awesome. So I think I'd love to just kind of wrap up. We didn't talk, I know we mentioned mesenchymal cells, but maybe they're important. I know we talked about peptides already. Prolotherapy, am I saying that correctly?
Yeah, prolotherapy.
So I don't really know too much about that. So maybe what we can do is just kind of talk about those two things, and then we'll kind of finish as we usually do with the
I want to
3
make
tips
sure
on.
that is prolotherapy the same as PRP?
I don't know. Let me see.
Because we did PRP.
Prolotherapy, the same as PRP. Plasma-rich protein. How are the two different? So it seems like I don't know.
Let's see.
The substance is being injected. So the primary difference between prolotherapy and PRP is the substance is being injected.
Yeah, I'm not very proficient in it.
Okay, so
either,
we don't have to
so
talk about it. That's fine. That's fine.
I think we should talk more about the mesenchymal cells.
Perfect. Okay, so we'll talk about that, and then we'll kind of go into wrapping up and next steps for people
To reach out, yeah.
yeah. So I'm encouraged that it seems like if it takes, you're going to know pretty quickly. So that investment you make, you're going to
It's
know.
very fast.
Yeah, that's great to get that instant feedback. That doesn't always
Plus,
happen.
at this
healthcare.
clinic, they're not like, oh, it didn't work for you. Like we're gonna follow up, and there's
Yeah.
very good follow up procedure where we want to make sure that their investment actually comes to fruition.
Oh, nice, perfect. Okay, Todd, I think we're ready for our final segment. Thank you.
Welcome back to Healthcare Corner, where you're a part of the conversation with your host, Gavin Wiswell and Dr. Mansi Shah.
Welcome back to the Healthcare Corner, everyone. And Monsi, something that stuck out over the last segment, we were talking over the break, really is that the efficacy of these cells really seem to be pretty quick. And so I'd love for you to maybe just kind of put a button on your experience, and heaven forbid that the injection didn't work. What do some of these clinics do? Is it just, hey, you're out of money, sorry? Or is there a process behind it to try and ensure that you can get the benefit that you sought?
Absolutely. I cannot speak for other clinics, but the clinic that I have been to, they're really, really good at putting patient first. And they understand that some of these patients are making one of the biggest investments out of pocket in their own health. So they have very, very good follow-up protocols, and they want to make sure how the patients are doing 30 days, 60 days, 90 days out, and what kind of results they're getting. And that's what I've been like a patient of, right? So I've been going through that same procedure with them, and they check with me like in the first week and then the second week, and now it'll be 30 days later. So it's not like, oh, sorry, it didn't work. They're gonna find out what was missing and then how they can rectify that. But the best thing with a proper loading dose of these mesenchymal cells is that it will work in majority of the capacity, and then if there's added treatments needed, that would be something to talk about. So that's why picking a clinic that is patient-centered is the key to this.
So again, MSCs or mesenchymal stem cells, um, they're going to work. Now on the reverse side of that, if they don't work, is the only I guess side effect that it didn't work, or can there be negative kind of contraindications of the stem cells, like a reaction to receiving those stem cells?
I mean, I personally don't know of that because the clinic I picked has either high level of responders or non-responders, right? Which is very small
But
percentage.
it's not like mortality where someone could die typically.
No, that I don't know of, because from all the research and the I would say the consults I did with one of the top docs there, that was my question, and this is the result that came out of that. So basically, mesenchymal stem cells are the ones that I got, and why I picked those is because they're multipotent stem cells found in bone marrow that are important for making the repair for the skeletal tissue and cartilage and bone and fat around the bone marrow. And that's what I was looking is if there is things that needs healing in my gut, I wanted to do that with the MSC cells, and that was the reason I went with this clinic.
Gotcha. So, as we always do here on the show, Monsi, we love to kind of tie everything back together and give our audience 3 points to consider, maybe 3 ways to research. Usually it's what you can do with your health, your exercise, your sleeping habits. But today, maybe it's more focused on education and understanding about what's out there. And it really sounds like if you have the resources, your first step would be to see a provider like yourself.
Right.
What other types of advice would you give our listeners today?
I would say definitely go with someone who's tried it themselves and has been the product of the product, and understanding why they picked the clinic that they did to go out there. And then, of course, what is the type of treatments out there, like how knowledgeable they are. And then cost wise too, of course, I picked a clinic that was I would say responsible when it came to not charging
Not overcharging, but yeah, for the quality that
these
you
are
have.
high quality cells.
Right.
They could have charged me extravagantly,
Yeah.
which they did not. Like when I compared to the Panama clinic, it was a very, very good price. So there's so many different things, and that's why reach out to different providers who are proficient in this research. And then at the end of the day, it depends on what clinic you decide to go with, because there's very little knowledge out here. That's the biggest challenge. So yeah, more than happy to answer any questions that our audience has.
And you can always find us at hcshow.net or send us an email at info@hcshow.net. So especially on this episode, as you can tell, I'm the one that gets to ask Dr. Shaw all the questions here. So if you have questions on regenerative medicine, definitely direct them to Dr. Monsi, and she'll be able to get back with you those answers and what to do. But I think for our international listeners, there might be some local options for you. For our U.S.-based listeners, especially here in San Diego, or maybe some border states that you have an opportunity to maybe easily access clinics in other countries, that's something that you want to look into. But ultimately, what I'm hearing is don't wait until it's too late. Make sure that if you're experiencing an issue, that you continue to go for that root cause analysis, right? And
Yeah.
unfortunately, in your case, it was over a decade where you had remission, it seems like, and then you had an acute case. And so
Yep.
stay with it, right? And continue to find that root cause.
Like, I definitely worked on my root cause, but then I immediately also didn't wait too long to get a treatment that would really enhance the body's healing potential, right? So that's the whole key is I think a lot of people put their health on the most bottom of the priority, and that's where things get out of control. So these stem cell clinics, they do decline patients all the time because they don't want to take a patient who's gone too far out. So, like, be a candidate for, even if you have the resources, all the money in the world cannot change how your processes happen in the body, and then if you're going to be accepted or not, right?
Right. So it sounds like the process isn't either overnight. You just can't wake up one morning and say, "Oh, hey, I'm going to go get some stem cells today. Take a nice trip to Mexico, enjoy the beach." Right? That's not normal. Normally, how it goes. So, again, what I was hearing, and as we recap the episode, is that you're going to want to talk to a functional medicine expert. You're going to want to get that workup done. So you want your labs. You're going to want to make sure that you understand of the 5 different types of cells, which is the right cell for you. And I think, Mons, you would be able to help clients determine maybe the top 2 types of cells. And is it ever the case where they qualify for maybe the mesenchymal cell, but maybe not the epithelial cell?
Yeah, I mean, that is depending again on the clinic and what type of cells that they offer.
Right.
Like the clinic that I picked, they only deal with MSC cells because from all the research of 18 years, it's found that we're dealing with xeno free, which is no external impurities, is what we want to go with. And that's why I went with that cell.
And just from my own experience, from the technological side, we've talked to a lot of different labs out there here in the U.S. where they're looking to get really, it's a fast track program with the FDA that allows them to do these investigative new drugs. And so these IND programs are out there. So, like you had mentioned, Monsi, maybe we're slower to be able to deliver care to our population, but the research is here.
Absolutely.
And so with the technology, with the ability to now, say, have remote patient monitoring with that patient, now they can be a part of a study in Florida and live in San Diego.
Yeah.
Right. And so I think it's that kind of interesting stuff and technology that is going to allow for the proliferation of these MSCs and stem cell research for the future here in the U.S. Would you agree?
Absolutely. So that's why, I was a part of the clinical trial where this lab is actually in congruence with Indiana University, and they're doing the research with these specific MSC cells to get that validation on, from an American university.
It's fascinating. I was very excited for this topic as soon as we decided it, because really that's the future of healthcare, right? Is the proactive, preventative, and when our bodies shut down and we can't fix them like we used to, well, what are our opportunities? And so to be able to have stem cells and for we want to stay away from some certain topics, but the people that are donating outside of the country, right? Maybe that'll be another topic that we can go into on maybe the risks and benefits of that research. Because I know that here in the U.S. you have people that donate platelets and blood and all that sort of thing. So we won't have time to go into it here on the Healthcare Corner, but we will maybe discuss that at a later date on the risks and benefits of that sort of thing.
Absolutely.
Yeah.
Also, for my functional medicine education that I provide, our audience can go on yourgutdr.com, and there's all the gut protocols that I have laid out there so they can understand what are the 5 R's of gut that they can do on their own.
And another plug for you on LinkedIn. I know you've got a great following there. So what would be the best way for them to find you there as well?
On LinkedIn, just Dr. Mansi, Mansi. Shah, Shah, and then when my LinkedIn profile comes up, it would be Dr. Mansi J. Shah, or they can text me at 858-899-8880 and just say gut health. That way I would know that they are the candidates from our show here.
And now that we've got the video portion of it, you can see who you are, right? This is so great to have you on our video stream as well for this episode. So very exciting information. Any final thoughts for our listeners today, Monsi?
Honestly, I would just say that don't wait. Of course, don't compromise on your basic things, which is eat right, sleep well, move your body. And if you feel like you're doing all the right things and it's still not working, do a functional medicine protocol and then find an expert who can really find the root cause, because root cause is where all the problems are lying. So if you have a tree or a plant that's decaying and the leaves are becoming brown, you're not going to go and paint green color on it. You're going to look at the roots.
Right.
You're going to look at the soil. You're going to look at the moisture,
sure.
the sunlight. That's what we're doing as functional providers.
So as always, what a great opportunity for us to learn more here on the Healthcare Corner. So stick with us every week as we continue to learn all things about healthcare so that you're more informed and can make those proactive decisions about your health. So we hope you have a wonderful weekend, and we'll see you next week here on the Healthcare Corner. Thank you.
Thank you.
And to make this kind of reversal more than a year later, saying, well, in fact, we now believe it's likely. But we know, as one of the commenters put in, it's been 3 years, and that gives China 3 years to purge all of the kind of evidence or witnesses. We had witnesses show up that disappeared in places like that. 3 years, it makes it tougher and tougher to peg it down on who exactly was involved, especially when you're talking like with a bad actor like China.
I think that is precisely correct. So we've given China a 3-year head start on hiding relevant information. Was China engaged in an intentional campaign to essentially leak this virus and cause economic and human pain on the American people? If that is the case, we should impose punitive tariffs. But also keep in mind, it is important for the American people to understand whether or not there was any involvement by U.S. government officials, including officials tied to the CDC or tied to Dr. Fauci, because keep in mind, the United States has funded gain-of-function research, and so it's very possible that there are culpable actors with respect to COVID-19 in the United States, and those individuals should also be